Welcome to the Low Carb Conferences podcast. I'm your host, Dr. Jeff Gerber. And today our special guest is Dr. Richard Johnson, and he'll be speaking at our conference in February. Richard's been a big supporter of the event, and we finally get him as a speaker. It seems like it's been way too long. So how's it going, Richard?
Hey, great, Jeff. It's really wonderful to meet with you by Zoom, though.
Yeah, well, we're neighbors, and
Yeah,
sometimes it's just easier to do it this way.
yeah, absolutely.
Yeah, so a little bit more about Richard. He's a professor of medicine at the University of Colorado and is a clinician, educator, researcher, lecturer, and author. He's board certified in internal medicine, infectious disease, and kidney disease. For more than 20 years, he's led research on the cause of obesity and diabetes, with special interest in the role of sugar, especially fructose and uric acid. He lectures all over the world, has published over 700 papers, and is recognized as a leader in his field. He's now authored 3 books, including his latest, Nature's Wants Us to Be Fat, which I have right here in the background. And best of all, as we mentioned, Richard lives right here in Colorado, and we've known each other personally for years. So, Richard, if you can provide us with some more background and tell us about your professional and personal interests.
Sure. Okay, so as you mentioned, I'm a professor of medicine. I've spent all my life in academic medicine. I really enjoy clinical practice. And so I've been a clinician, but I've had a very major research interest. And for gosh, I hate to say how many years, but for decades, I've been doing research. And since about 1997 or so, I've become very interested in the cause of obesity, the cause of diabetes, big questions. And our work has led us to the discovery of a pathway that we think is really, really involved in driving obesity. And I've written about it. It actually appears to be like a biologic switch that's turned on and off by it's how animals, we believe it's how animals prepare for things like hibernation when they get really fat right before they hibernate. And it involves carbs. And so my road took me into the world of carbs and low carb diets. And because it seems to be such an effective method for addressing this switch. But we had some other surprises that I'm really going to be happy to share with you, other tricks on how to lose weight based upon this biologic switch. And so that's the nutshell. I'm still doing active research. We've even discovered that this pathway that's driving obesity that involves sugar also drives alcoholism. So I have a very big grant right now where we're trying to show that when you block sugar pathways, you actually can block alcoholism. So it's really a very exciting thing. It's also taken us into the world of Alzheimer's disease. It's taken us into the world of dementias and behavioral disorders, into cancer. So this pathway turns out to be very important and to be driving a lot of things. It's quite upstream. So it's really initiated by diet. And so I'm really looking forward to coming and speaking at your at this great event and sharing our breakthroughs with the group and then discussing it and challenging it or being challenged. I'm looking forward to nice discussions.
Yeah. Yeah, well, that's great, Richard. It sounds like you've gotten into the area of brain health. You just
Yes.
mentioned a whole lot about aging and
Yes.
the reward system.
Oh,
Yeah,
absolutely. Yeah. So the switch, I don't know. Do you want me to talk just a little bit about how the switch works or not yet?
I do, but if we can back up a little bit.
Sure.
So I'm always intrigued that your main field has been the study of kidneys and nephrology, and I'd like you to share with us a little more information about how maybe it started as kidney research and then it led you down this path to obesity.
Yeah. Okay. Sure. Absolutely. So I was very interested in what caused kidney disease. And I was interested in things like diabetes and how it caused kidney disease and in general. And also I was very interested in high blood pressure. And high blood pressure is thought to be due to a defect in the kidneys where they can't excrete salt very well. And so I got the idea that it might be some kind of acquired injury to the kidney that then blocked the ability for the kidney to get rid of salt. And I was studying that, and we had this very cool surprise where we could make animals develop high blood pressure in response to salt by just causing really subtle kidney damage. So subtle that the kidney functions normal. Everything looks normal, but if you actually look in the kidney, you can see evidence that there's subtle things going on. And so I started there. So I was trying to figure out the cause of high blood pressure. And actually, our work really has really shed light on that. And because it turns out that it is subtle injury to the kidney that seems to be driving high blood pressure, subtle inflammation, actually. As we were looking at what caused that subtle inflammation, it took me to a substance called uric acid. And people with high uric acid have a very, very high frequency of developing high blood pressure. And we found that uric acid is usually associated with a disease called gout, but it's actually very strongly associated with obesity and high blood pressure. And we actually found that when we raised uric acid in animals, they got that subtle kidney damage over time that caused hypertension. So now I had a link between uric acid and blood pressure. And then the question was, well, okay, so if uric acid's involved, and we actually studied kids, and we found that kids presenting with high blood pressure all had high uric acids. And we did this big study. We published it in the JAMA, which is a big medical journal. And we found that when we lowered the uric acid, we could correct the blood pressure. It turns out that this uric acid blood pressure link occurs in early hypertension. And over time, you get the subtle kidney damage. And then once you have the subtle kidney damage, then it's the kidney that drives high blood pressure. So this is like the initiator, not necessarily the thing that continues causing hypertension over a lifetime. So then we were thinking, okay, well, uric acid is really important. And then I wrote an editorial on this for the New England Journal, and I got interviewed by Gary Taubes. This is right around 2000. And so we were talking about how uric acid seems to be linked with high blood pressure and obesity. And so we started talking on the phone about what makes uric acid go up. And the classic teaching is that it's purines. It's like often meaty foods, but actually it's known that sugar, and especially fructose, can raise uric acid. And so when I was talking to Gary, and he says, well, what do you think's driving up the uric acid? I said, well, I do think it could be sugar. And of course that he was just getting interested in sugar at the time as well. And so we talked for quite a bit on sugar and its potential to possibly drive this uric acid up. And at that point, I had already sort of decided to do an experiment, but that discussion made me want to do it all the more. And we put animals on fructose, which is the component of sugar that drives up uric acid. And when we put the animals on fructose, their uric acids went up and they became hypertensive. And then we gave them a drug to lower the uric acid, thinking that will it lower the blood pressure? Well, guess what? It didn't just lower the blood pressure. It blocked weight gain and blocked the rise in triglycerides and blocked fat formation and blocked fatty liver to some extent. It was like, what? Lowering uric acid has a benefit like this? And it's like it's an early effect. It's not like what happens with obesity is that this pathway is involved early on, and then what happens is we start reducing our mitochondria. They get damaged through this process, and then you kind of get trapped a little bit into being overweight, where lowering uric acid doesn't show as much benefit. So it's really an early effect.
Yeah. I want you to go on. So it sounds like you found a marketable drug that treats obesity.
Yes, actually. So when we did do some clinical studies, and we found that it actually does lower or reduce weight. It really is more effective at preventing weight gain than it is at reducing weight. To really, once you get fat, you really had to lose the weight. You have to do the classic thing like calorie restriction and or go on a low carb diet or something, these kind of classic intermittent fasting, because you got to burn off the fat. So I'm looking at what causes the fat to go up. So when you block uric acid, you have a better effect at blocking weight gain than you do at blocking or it's inducing weight loss. But
Yeah.
it does look like it, I mean, we've shown that it's that in several trials that we can block weight gain, and actually in some of these trials we've seen some weight loss, but it's relatively mild. We do think that if you can block fructose metabolism, that you'll have a winning drug. And there's now large numbers of companies that are trying to make drugs to block fructose metabolism. And
Yeah. Well,
Eli
Richard,
Lilly and
yeah, we're talking about nutrition today, but it was just interesting because now you have substances, and I don't even know if you
yeah,
can name that substances.
yeah,
Those substances, they're probably research
yeah,
material at the present time, but it's just interesting that you mentioned that.
yeah. So anyway, so then we started studying fructose. We go, oh my gosh, fructose is inducing this thing. And here, when we lower uric acid, we're blocking some of fructose effects, but lowering uric acid doesn't block the calories of fructose at all. It's so it was some kind of fructose was doing something independently of calories. And that is what really launched it. So right around 2002 or 2003, I became a fructose doctor. And I've been studying sugar and fructose since. And we've kind of discovered that this fructose pathway turns out to be much bigger than we had thought. So go ahead.
Yeah. So I thanks for sharing that. I didn't realize that it was Gary Taubes, a science reporter, that sparked and piqued your interest in fructose. So we do
Yeah,
have to give him some credit for that.
yeah, absolutely. Yeah, we had been talking a little bit about it, but it was really that conversation that made me, when I hung up, I go, you know what? We just have to put these animals on fructose. Yeah,
Yeah. Wow. Yeah, that's just fascinating.
yeah.
And so I want to go down that rabbit hole a little bit deeper, but I know that you travel all over the world, and
Yeah.
perhaps it's with your wife. You must enjoy traveling. But what is the nature of these trips? Is it to discuss your research? Is it to discuss your book? Is it one and the same? What are you doing?
Well, I do travel a lot. I'm fortunate enough that my research has attracted a lot of attention. And so I end up going and giving lectures about my work. I have two major areas of work. My major area has been on the cause of obesity and diabetes, as I mentioned, and the role of sugar. But also, our work took us into trying to understand how climate change affects health. And I've done a lot of work on climate change, especially as how it can affect kidney disease, but also now we're looking at how it can drive obesity and diabetes and things like that. So probably half of my traveling is related to speaking related to climate change and its effects on health. And probably half, or maybe a little more than half, focuses on fructose. There's a huge epidemic of kidney disease going on in Central America, India. That's we link to climate change, and we think it's the first epidemic from ongoing climate change. It is partly linked with fructose because we can. It's kind of complicated, but a lot of these people are out working in the fields and they're drinking the wrong kind of hydration fluid. So they're drinking sweetened drinks that really can cause problems when you're dehydrated. You shouldn't be drinking soft drinks. They're dehydrating anyway, and they really can cause obesity. But if you're drinking it as trying to hydrate yourself while you're working out in the fields, it's really an error. It can cause kidney damage and all kinds of things. So, uh, so that's mainly. I was recently in London. There was a fantastic conference on obesity. It was just, I saw that the New York Times did a little write up on it last week. But this was a meeting to try to bring together the different theories of obesity. And I was able to present my theory. And I'm happy to tell you that I do think that our work can bridge a lot of the different obesity theories out there. And I've written a paper that's tries to unite the different evidences and shows that everything actually fits. And even the people who talk about a calorie as a calorie, you can actually show how this carb pathway can be associated with that. So it's sort of cool. I don't know if you want me to try to explain that or not, but
Hold the thought. I really want to discuss that because the theme of our conference is where is nutrition headed, and we're trying to find
right,
some common themes and bring
right,
it together. And I always joke that our genetics haven't changed, but the
right.
conversation always changes.
Exactly.
Yeah, but I'm very interested in the environmental issue, and I thought I heard you say that the environment is making us ill. I thought it
Oh,
was
yes.
that we're making the environment ill, but this
Yeah, there's two,
oh,
so if you think about it in big scope, in the last 150 years, 60 years, the dominant diseases that we're having are things like obesity, diabetes, fatty liver, high blood pressure. And these are all nested together and linked. They're all very much correlated with each other. And we're figuring out what causes that. And I think there's going to be a time coming not too far from now where we're going to really be able to reduce those diseases dramatically. And but what's happening is there's a new set of diseases that are just beginning to show themselves. And these are diseases of the environment. There are a lot of them are toxins. We've been identifying toxins as causing kidney disease and other problems from the environment. And also climate change, really chronic heat stress, dehydration. They trigger their own sets of diseases. And so I do believe that we're at the cusp where we're actually going to start, you don't see it yet, but there's so many breakthroughs going on in obesity and diabetes. These diseases, they're going to go away. They're going to go away. I predict 30 years from now, there won't be too many cases of type 2 diabetes, and there won't be that much obesity. I think that people are figuring out what causes it. The low carb diet was really a fantastic start, but I think that there are going to be other ways that people are going to block this in the future, and so I could be wrong. I could be wrong, but I really believe we're on that cusp, just like it was in 1890, where before 1890, what was killing everybody was infectious diseases. And then we got antibiotics and vaccines and all these other things came between about 1870 and 1940. And it was able to really suppress a lot of that. Now, not completely, we're still fighting viral infections and so forth. But we really had a big break where with the onset of antibiotics and good public hygiene and then these new diseases came up. I mean, obesity, high blood pressure, they were rare before 1890, and by 1970 they were just taking over the world, and they're still kind of in charge of most of the health issues of the world seem to be related to these diseases. And so, but I think we're gonna see a transition.
well, Richard, we have your prediction recorded, so let's stay tuned, and that really brings us some hope. And just to finish up with the environment issue, so you really make the point that the environment is an issue that's
Oh yeah.
important in both directions. And from our perspective, we think that there's three important things to consider, and that is our health, the environment, and the ethical treatment of animals. And we all care about that.
I agree 100%. We
Great.
have to take care of the animals in nature, just as our the impact of our civilizations are really can have a very negative impact, not on just the regular environment and toxins and everything, but it carries over to the animals in the world and the
Good,
plants.
Richard. Yeah.
I'm a big believer in humanity and the love of animals, um, and even though I do research that involves some animal research, it's always done in the most humane way, and we only do it when it's absolutely necessary.
Good, Richard. Well, listen, let's take a dive into what you described a couple minutes ago as this unifying principle
Yeah,
that kind of brings all of our ideas about nutrition together.
yeah. So our work initially suggested that fructose was really something was special about it. It was working some different way than just a regular calorie. And we found that when we gave fructose to animals, they developed this thing called the metabolic syndrome, and they became obese, and their triglycerides went up, they got fatty liver, their blood pressure went up. It was the same thing that we call metabolic syndrome. And but also there were other parts of it that probably part of the metabolic syndrome as well, but we just not well characterized. And it induced hunger, it induced thirst, it induced foraging behavior where animals would forage for food. It dropped the resting metabolism, but it left energy available for when you're foraging, so that it kind of helped balance things out. And it also increased fat, not just in the fat tissues, but in the liver and the blood. It raised blood pressure. It did a really interesting thing. It actually protects animals from low oxygen states. And the way it does that is that the mitochondria make all the energy in the body. They make it, well, they don't make all the energy, but they make a lot of the energy. And we call it ATP. And there's really two types of energy. There's the energy we use, which is the ATP, and then there's the energy we store, which is fat. And when the mitochondria make ATP, they use oxygen, and that's really where we get our oxygen, where we use our oxygen, a lot of it. And so what happens is when you eat fructose, it suppresses the energy production by the mitochondria. So they make less ATP, and so they use less oxygen. So an animal can survive in a burrow like a low oxygen hypoxic type environment. They can survive if they switch to fructose metabolism. It's sort of like the Warburg effect. These animals can live on a low oxygen because they're not relying on the mitochondria to make so much energy. They live with a low energy state. And so the calories they eat, instead of going to the mitochondria, they're turned into stored energy like fat. So it shunts the calories in towards fat. And that's how this fructose works. It drops the ATP in the cell, creating kind of a low energy state. But it's not a low total energy because the stored energy builds up. And so
Does
it's kind of a brilliant system.
does fermentation play a role in that as well? That it shifts to
Yeah, so
fermentation?
yeah, a little bit actually. But what happens is, yeah, you get this thing called glycolysis, where animals will. There is another way to make energy. It's a more primitive way, and they can make it from glucose, and it's called glycolysis, and so that goes up. And interesting, like cancer cells also, they are in a low oxygen state because when they metastasize, they don't have a good blood supply initially. They have to generate a blood supply, so they kind of live in a low oxygen state. So they love fructose as a fuel because it helps them. And so there are all these cancers that you can increase their growth rapidly by giving them fructose or uric acid, because uric acid suppresses the mitochondria too. And
This is in
so,
animal models, correct?
yeah, in animal models. So, like if I raise uric acid in a mouse and then inject it with a tumor, it rapidly spreads throughout the body. And so it turns out that a bunch of cancers are associated with obesity, and they're all the ones that seem to like fructose. Not all cancers like fructose, but so there is this big story coming that sugar and fructose are involved in cancers, and it's actually part of this biologic response. It was meant to be a survival response, help animals prepare for when there's no food available, or when there's no oxygen, or when there's no water. fat is also a source of water. So if an animal gets fat, it can break down the fat to provide water. That's why camels have a hump, and so when they need the water, they can break it down. And why whales are so fat, it isn't just for insulation. They use the fat as a source of water. So this process of creating taking fructose is what animals love to do to try to prepare for times when there's not good resources around. So it was meant to be a survival thing. The problem is two things happened. We had a mutation in uric acid where we have higher uric acids, and the effect of that was to make us much more sensitive to sugar. So we are very sensitive to the effects of sugar. And then the second problem is that sugar intake went way up, and high fructose corn syrup intake went way up, and that combination switched us from protecting us from starvation to actively driving us to be fat. So it's a very interesting thing. And I knew that things like French fries that don't have much sugar in them, they're not good, they're fattening. And so, I realized that there was something missing in my story. And working with all these researchers in my lab and others, especially a guy named Miguel Lanaspa, we started looking at this, and we realized that not only is it the fructose that we eat, but our bodies can make fructose, and they make fructose from carbs. They make fructose from glucose. And so it turns out that when you're eating potatoes and rice and bread, and that blood glucose goes up after we eat, we call it the, postprandial hyperglycemia, or, basically these are what we call high glycemic foods. So when you eat them, the glucose levels go up in the blood. When it goes up in the blood, it doesn't just trigger insulin, it actually triggers the conversion of glucose to fructose. So, and there's now been shown in people too, so that if you give a high glycemic diet of foods to people, they will start making fructose. And so you can make fructose from carbs, and the classic one is these high glycemic carbs. And it turns out that salt activates the conversion, so it stimulates the conversion. And so when you go on a low carb diet, not only are you blocking the fructose you eat, but because you're on a low carb diet, you don't really get these high glucose levels because you're not eating much carbs. You can make glucose, but you don't make enough to actually drive your blood glucose up. And what happens is you block the fructose formation too. So the low carb diet is just fantastic at blocking this pathway. And even the salt, if you eat salt, but you're in a low carb diet, it's not going to be a problem, because the way salt works is it converts glucose to fructose. So if there's no glucose around, you can be on a high salt diet and a low carb diet. And as you know, the first week or two, when you're on a low carb diet, you lose water and salt. It's actually good to have that. So that was kind of the big breakthrough, was realizing that fructose can also be made. And that led me to this, to really the power of the low carb diet. And then I've actually realized the importance of calories as well. And the insight there is that we did these studies, and we found that if we put animals on a high carb diet, and especially if they start making fructose, that they lose their ability to regulate their weight, and they start gaining weight. And it's because they develop a thing called leptin resistance. And leptin is a hormone that blocks or stimulates satiety. So it makes you feel full, and it goes up to tell you to quit eating. But people who are overweight often are resistant to the effects of leptin. And what causes that leptin resistance appears to be fructose. We've done a number of studies. Fat doesn't do it, but fructose does. And so when you're on a high carb diet, you become leptin resistant. So then once you're leptin resistant, the best way to gain weight is to actually eat fat, because fat has like 9 calories per gram. I mean, 9 calories per gram versus 4 calories per gram for carbs. And so what happens is, if you're on a high fat diet and you're leptin resistance, your weight goes up fast. And if you go on a low fat diet, well, your leptin resistance, your weight comes down, because the fat is like the firewood, but the fire is actually the fructose. So But when you're on a low carb diet, there's no leptin resistance, so you can eat that high fat diet and you're not going to get into trouble. And so suddenly I can explain these things, and then I realized that the people who say a calorie is a calorie, they're looking at people who are already leptin resistant, where fat really is driving weight gain. But we who are in the carb world know that if you go on a low carb diet, you can really have better outcomes. And it's because you're getting at the actual cause of what's driving this whole metabolic syndrome. And the other a wonderful thing is that when you go on a carb restriction, you also block, insulin resistance and all these other blood pressure and a lot of things that are not so much driven by fat, but are driven by this pathway, this fructose pathway.
Yeah, wow, Richard, that's just absolutely fascinating.
Yeah.
And it does kind of unify and bring things together.
Yeah.
And it also brings up the concept of body composition. So
Yes.
if we have a normal body composition, so we're lean and muscular, you're basically saying we can metabolize nutrition properly. And so, but the problem is not everyone has this normal body composition. So we're
Right.
dealing with people that are overweight and then they're leptin resistance. And it brings up this concept. And I know Gary Taubes has said it in the past. Are we overweight because we eat too much, or do we eat too much because we're overweight?
Yeah.
And this brings up the
Right.
issue of leptin resistance. But I
Yes.
love how you bring it all together.
Thank you.
And
The other really, really key thing is, so these are the things that initiate weight gain and so forth. We believe this is like the main mechanism, but there is this problem, and the way fructose reduces the energy production is to cause oxidative stress to the mitochondria. So there's this. It's sort of like putting some stress on those mitochondria so they don't make as much energy, and it's an oxidative stress, and it's temporary with the fructose. But what happens is when you continue to be exposed to fructose, these mitochondria are being hit again and again and again and again with oxidative stress, and they start to wear out, and they can actually undergo a thing called fission, and they can become damaged. And what happens is, as we get older, these mitochondria actually start to get lower in number, and so we kind of get locked into a low energy state, and that wants to keep us obese. So then if we lose weight, and if we really have low mitochondria, it will be very hard to keep the weight down unless you just like starving yourself. And because just eating small amounts of food will tend to cause weight gain. So what we have to do is we have to repair those mitochondria. And this is where exercise and all these wonderful techniques are out there to try to stimulate mitochondrial growth. And there's even people now doing mitochondrial transplants in animals, which is really, really wild. But it seems to me that the two things to try to stimulate the mitochondria to come back. The first thing is you got to quit injuring them, and then the second, because they will recover just by stopping the injury, they will recover slowly, but then we have to accelerate recovery. And exercise is probably one of the very best ways. But there's, all these tricks: dark chocolate, vitamin C, green teas, all these things can actually stimulate a little bit of growth too. So that's really where the next step is how can we bring back our mitochondria? And if we could bring it back to the way we had them when we're 20, we're going to have the energy of a 20-year-old.
Great, Richard. So, you clearly stated that in terms of the sugars, fructose is the worst in terms of damaging mitochondria and oxidative stress. And so, look, we have this other fuel, which is fat. And so I thought you were kind of heading to make the statement that eating fat in general might be a way to reduce oxidative stress in the mitochondria, but you didn't specifically say that. So
Well,
I'm
low
asking the
carbs
question.
diets, they work. So actually we did some studies with low fructose diets and low salt diets, and we can stimulate mitochondrial numbers in people just by reducing sugar intake. And I'm sure it's true for low carb. It's probably even more powerful. It would be fantastic to do studies with the keto diet or with a low carb diet, looking at how it affects the mitochondria. I don't think there's been that many studies that have done that, but it should really stimulate mitochondrial growth. And I do think that there are a lot of people who feel that when they go on a low carb diet, that they start feeling just a lot better. Um, but it's hard in this world for a lot of people to successfully stay on a low carb diet just because of the environment. You can't, you can be on a low carb diet, and like if you're traveling and they take you to a place where they're serving the food, it can be tricky. You have to like pick and choose, but it's like, it's hard. I think it's not so easy for everyone to do that. Um, so the challenge is there, but you are probably one of the great leaders. You're certainly the greatest leader in this whole region for helping people get them on a low carb diet or a keto diet, and you've had great success. But it's a challenge. My hat's off to you for all you've done to help people. And what kind of, when you are giving your diet recommendations, what percentage of people will still be on a low carb diet like 6 months later? Is it pretty good right now? Year?
Well, Well, I just teaching people, first of all, thank you for the comments. And, nutrition education is my legacy. I'm not a researcher. So this is, we both make significant contributions. And, I still enjoy working in the healthcare system and, helping patients and individuals navigate through the landmines of healthcare.
Right.
That's kind of where I sit. And teaching people how to eat better is rewarding, since I've learned better myself. And
Yeah.
indeed, it is sustainable. And we have success stories of people losing weight, improving their metabolic health, looking at longevity. I wish I could say that we're a clinical research center, but we're not. But in a sense, they're all anecdotes because we don't do
Yeah,
research, but
sure.
we have one anecdote after
Yeah, no,
the
that's
other,
good.
Richard. Yeah. So I want to back up. I think we could go on all day with this, but I'm really fascinated with mitochondrial health, and
Me too.
and I gave a mechanistic talk several years back looking at oxidative stress and mitochondria. And I would tell you, before I got on stage, I had done a significant amount of research and even had spoken with Michael Eads and Peter D, who's hyperlipid. And discussing this mechanistic perspective that in fact the oxidation of fat through mitochondria, and looking at the mitochondrial membrane, that fat serves as kind of it produces energy, but much more slowly compared to glucose. And that may be a mechanism that
Yeah.
reduces oxidative stress. And I would say that would be interesting for your group to look
Yeah.
into that, and specifically how fat versus carbohydrate affects oxidative stress in the mitochondria.
I think that makes a lot of sense. That's a very, very good idea. Thank you.
Well, look, if Gary Taubes can do it, why not myself?
I am a person who, I'm very curious and I love comments from anybody, especially people like you who have so much expertise. But it doesn't matter who you are. I'm going to listen because a good idea can come from anybody. And yeah, and if I listen, I have a better chance to pick up those ideas.
Well, Richard, thank you. And just to our audience, if when you're listening to Richard talk, how he simply explains things and he's so approachable. And this is the beauty of having you come to our event and you can meet people in person. And I don't think we've ever had this much time to speak with one another. And
Yeah, it's a
you
great delight. It's a great delight.
I feel some warmth coming from you. That's wonderful.
There's a lot of warmth I have for what you guys are doing. And the more I study, the more I realize how great the low carb diet is. And I do think that our work is now linking this fructose pathway with Alzheimer's. And we have a paper that will come out soon on this. And it really looks to me like carbs have a major role in driving Alzheimer's, and that a low carb diet should have really significant benefits in protecting, especially in the earliest phase. Again, it's one of those things. Once you start losing the mitochondria, the game is no longer to prevent the injury as much as it is to try to bring back the mitochondria. But either way, this would be low carb diets really look like a great approach for general living. I think we're eating too much carbs
Well,
right now, and we should, the right percent. I don't really know what it is, but there's a lot of people eating 50% of their diet is carbs, and I think that's probably too much.
yeah. Well, Richard, it's all going to come together. So we have Chris Palmer and Brett Scher will be talking
Wow,
about psychiatric health, brain health, and
wonderful.
I think at the end, people will really get a good perspective from
Yeah.
all angles. And so you didn't say it, but I'd like you to at this point. What the switch is?
Yeah. So the biologic switch is really triggered by the metabolism of fructose. And fructose is the only nutrient that lowers the ATP. And so it lowers the ATP about 30%. It can be from 10% to like 40%. And the lower it goes, the stronger the activation of this switch. And the switch is this thing where you start getting hungry, thirsty, you're foraging, you start accumulating fat, you start eating more than you normally do because you become leptin resistant. You drop your resting metabolism. So when you're not foraging, you actually drop your energy levels even further in terms of what burning the energy. And your blood pressure goes up. You start putting fat in your liver. It's the whole 9 yards. It's this thing we call metabolic syndrome, but it can be even expanded a little further. And so that's the biologic switch. And animals use fructose or make fructose as a way to do this. And it's meant to help you. It was meant to help when you didn't have food around, that you could get these fat stores so that you could make it through winter. You could make it for that long distance migration without having to stop to eat or whatever. You could use your fat as your energy source. But what's happened is we keep activating this, and we are not hibernating, and we are not going on long distance migration flights. And so what's happened is we're accumulating this, and we're becoming pre-diabetic and then diabetic, and we're developing fatty liver and then cirrhosis, and we're developing elevated blood pressure and then hypertension. And it just gets, they progress from one level to the next, and before you know it, we're very sick. And it's because of this switch.
Thank you for saying it. And so, your research started with uric acid,
Right,
and then it brought you to fructose. And now, David Perlmutter writes a book, Drop Acid,
right.
and he's referring to uric acid. And now you're back on uric acid. It's kind of come full circle.
Yeah, no, I mean, I never really left uric acid. If you look at my research, I've been doing uric acid research all through this, and we definitely think that it's playing the role in how fructose works. And David is a wonderful author, David Perlmutter. I recommend you guys to get that book. And he and I are good friends, and we talk a lot about uric acid when we do meet. Um, and uh, and I, it really still appears to be a very, very important risk factor, underappreciated, that people should be measuring. And, I'll make sure to talk a little bit about it at the meeting with
Well,
you.
we tried to get Dr. Perlmutter, but he had a conflict. So
Oh,
maybe
that's too bad.
in next conference we'll have him
Yeah, no,
speak. But
he's wonderful.
yeah,
Absolutely wonderful.
you're gonna do a great job covering all these topics, I'm sure. So
Thank you.
yeah, well, great, Richard. Well, we can finish up, and always want to ask, what is it that you enjoy about coming to conferences in person?
The ability to meet people. You have a real, quite a few stars, a lot of people who I've always wanted to meet. And I saw that you now just invited Cynthia Thurlow, and and Nina Tykoltz. And some of these people like Nina, I wrote a paper with, and I've never met her personally. And I was on Cynthia Thurlow's podcast once, and she's really quite a remarkable person. And you have a lot of people that I looking forward to meeting. And I will say that, ideas are stimulated by conversations. And when you talking to people with lots of interests and lots of different viewpoints, it is a fantastic opportunity to get new ideas of how to move the needle forward or backward, but hopefully forward.
Well, continuing the conversation, and Richard, again, you're such a humble guy, and you didn't say I want to get up on stage and have these people praise me because of all the wonderful information I'm going to be sharing with them. It's quite the opposite.
No, I'm looking forward to learning from them, to be honest.
Wow, that's amazing coming from such a distinguished professor as yourself, and that's why we want you at our event.
Well, thank you.
And yeah, so how can the audience find out more about you?
So I do have this book, Nature Wants Us to Be Fat. It really summarizes a lot of the new work, and you can get it at almost any bookstore, Amazon, Books a Million. I have a website, drrichardjohnson.com. I have an Instagram, Dr. Richard J. Johnson, and I have a Twitter account that I'm just learning how to use called Richard J. Johns, JOHNS 11. So it's at Richard J. Johnson 11. But anyway, so the best way to reach me, probably is through my website, or you can try to email me. My email is available through PubMed. You can find a paper, and there's a lot of papers where I have my email there.
Great, Richard. Well, if you want to hear Richard in person, and also the other great speakers that we just mentioned, please consider attending in person or live to the conference in February. And for more information about the conference, please visit lowcarbconferences.com. And it's important to understand that we can't have the conference without you, the audience, attending. And your attendance really supports nutrition and science. And so we really appreciate everyone being at this event. So thanks again, Richard, and we'll certainly be in touch.
Yeah, thank you, Jeff.